New and exciting innovations in healthcare are now right here in Old Bridge Township with the new addition of the Medical Arts Building at Raritan Bay Medical Center. Today, we're going to give you a first look at the opening of this excellent new facility and give you some insight on what this means to the community of Old Bridge. You'll also see the inside scoop on the recent openings of the Jocelyn Diabetes Center and the new surgery center located in the building. We spoke with the medical directors of these divisions about what makes them unique. Plus, you'll see all of the individuals who helped make this facility a reality. So join us as we welcome you to the all-new Medical Arts Building at Raritan Bay Medical Center of Old Bridge.
A member of the Board of Directors of Raritan Bay Medical Center. I'm also the chairman of the foundation for the Raritan Bay Medical Center, and I enjoy wearing both hats. So, thank you. Thank you for being here. This is a great moment for our hospital. It's a great moment for our township, as I said earlier. We're going to get right on to hearing a lot about Raritan Bay Medical Center, and we're going to hear a lot about what's going on, and we have some wonderful guys to talk about it. So the first person that I want to bring up is a person who's been leading our pack now for the past couple of years, taking on the responsibilities of legislation in a hospital. He's the person that sets policy with us. He's our chairman of the board. He's the folks that we look for as a tremendous leader, and he's been a great leader. And I'd like to introduce Joe Jankowski, chairman of the Raritan Bay Medical Center.
Thank you. Good afternoon, and welcome to Raritan Bay Medical Center. This afternoon, we celebrate a most significant milestone, the opening of our first major building addition in 25 years. You know, it seems like it was just yesterday when I was standing in this very location with a shovel and a hard hat, breaking ground, and here we are. As hospital board chairman, I'm extremely excited to address you this afternoon on such a wonderful occasion. During my time as a board member, I've witnessed significant changes in the way that healthcare is delivered. So much care is delivered in the outpatient setting, leaving the hospital environment for the most critically ill patients. In our efforts to ensure that Raritan Bay Medical Center remains a cost-effective and highly efficient care provider while adapting to the new healthcare landscape, our board challenged our hospital executive leadership to grow services here at Old Bridge to meet the growing demands of the community. Today, we stand in front of that vision turned into reality. This new building is one of the most integrative healthcare facilities in the region, bringing together specialized outpatient services, ambulatory surgery services, inpatient surgical care, subspecialists in the areas of podiatry, vascular, cardiology, general surgeon, and even family medicine will be available right here. State-of-the-art imaging will be available, women's services will be available, and diabetes management will be also available here. Now, we could not have done this without the support of our very, very important partners. Landmark Healthcare, the host of physician specialists moving into this building shortly, in the township of Old Bridge. It's a partnership that we look forward to growing with even more physicians who we invite to be part of this spectacular project. Now, people say, and I sometimes believe, that good things happen in threes. We had the vision of this wonderful facility. That's number one. If you follow the news, you see that we are in merger negotiations with Meridian Health. That's number two. And if you follow the news, you'll see that Meridian Health is in merger negotiations with Hackensack Health System. That's number three. So, all of you, I say to you, family, friends, supporters, jump in and hang on, because we're going for the trifecta. Thank you.
Thank you very much, Joe. And of course, the hospital itself has to take on the responsibilities of healthcare, employees that we have employed, and all the welfare of all of those factors. And that's only done with a great leader. And our leader is our president, our CEO, and a very, very good friend, not only to all of our community, to all of us individually, and that's Mike Dagnes. Mike.
Thank you, Russ, and welcome everyone to what I think is a really historic day for Raritan Bay Medical Center and for the town of Old Bridge. I think in my almost 14 years at Raritan Bay Medical Center and in the many things that we've done, I think we've arrived at the pinnacle. As Joe said, this has been an incredible couple of weeks. From our standpoint, the roller coaster ride that we have been on since about 2007, 2008 has been unbelievable and has created whiplash amongst our staff, myself, our medical staff, and the board. But that's over. Here we are now at a point where a facility that we almost sold in 2008, 2009, we're expanding with a 100,000 square foot building that is a combination inpatient surgical hospital, ASC, ambulatory surgery center, an imaging center, physicians' offices, the Jocelyn Diabetes Center, and all in one building, which we did in concert with our partners, Landmark Healthcare Facilities. In mentioning the trifecta, I do want to mention those again. In the past 2 weeks, our hospital signed a letter of intent with the premier health system in the state of New Jersey, the Meridian Health System. Following closely after the Meridian Raritan Bay announcement came what is the biggest announcement in the state, I think, to date, and that was the announcement of the merger of Meridian Health and Hackensack University Medical Center and its system, bringing together now 11 acute care hospitals with a geography from North Jersey to South Jersey, with the belt in the middle of Raritan Bay Medical Center. And the last thing is, in the same couple of weeks, our superior outstanding nurses were recognized for the third time as magnet nurses. So in conclusion, I know I'm a little dry, but my excitement is sky high. I'm very excited about today. Today is the culmination of a lot of hard work by a lot of people who believed in a lot of people. And that dream has been realized. And the beneficiaries will be the residents of Middlesex County when this building, along with the rest of our services and the services of Perth Amboy, are linked with the Meridian Health System to be part of the best and biggest health system in the state of New Jersey. Thank you all for being here. Thank you very much.
Great words from a great guy. God has puts a lot of time and energy and his whole life into our hospital. Well, now comes some additional folks that are going to lead us in this hospital, okay? One such gentleman also is our medical director, also heads up our catheterization lab. He's a great guy. He's going to be honored at our annual gala in about a month, maybe less than that, as the Physician of the Year. He's done some wonderful things and very innovative in the way he's taken on his responsibilities. It gives me great pleasure to introduce Dr. Puneet Sagal.
Good afternoon and welcome. We are living through an exciting times in medicine and healthcare. On a daily basis, it's unbelievable level of innovation happening in treatment modalities, both technological as well as in pharmaceutical avenues. Our patients are living longer and healthier lives. The healthcare needs of the communities are changing across the nation as demographics change. It is my strong belief that physicians should lead the way as patient advocates, and they have the responsibility to work together with the hospital staff and the administrative leadership under the oversight of board of directors to make sure that their institute is able to provide the best and the latest medical services, technology, and the treatments, and is able to adapt to the healthcare needs of the community it serves. The new Medical Arts Building is the culmination of such efforts, and I want to congratulate everybody involved for their hard work and the support. At Raritan Bay Medical Center, I also have the privilege to lead cardiac catheterization lab as their medical director. We participated in Atlantic Seaport trial, which was the first trial on the Eastern Seaboard hospitals, which tested the hypothesis that the emergency as well as subsequently elective angioplasty can be provided in small community hospitals which don't have an open heart surgical backup. This trial's final results were published in 2012, which led to the availability of emergency as well as elective angioplasty in smaller community hospitals across the nation, and this has become a standard of care in the United States now. We are able to provide emergency heart attack care as well as elective angioplasty in our 2 catheterizations lab in our Perth Amboy division. The national standard to provide acute care for heart attack patients is 90 minutes. We always achieve this number. Actually, our lab has been doing 60 to 64 to 66 minutes on an ongoing basis. Our center is also designated as a primary stroke center. This expert level of care will now be even more available and accessible to Old Bridge residents as a number of physicians and surgeons, cardiologists, and vascular specialists have decided to make this building their home and will provide medical and surgical care here. I look forward to working very closely with these highly talented and respected medical physicians, and I know that people of Old Bridge will be impressed by the level of care available to them right in their own town. I personally want to thank each one of these physicians for their support. I also want residents of Old Bridge and surrounding towns to know that Raritan Bay Medical Center remains committed to caring for you and your families. Thank you for your time and attention.
Thank you very much, Doctor. The next person I want to introduce is an additional close friend. He's a wonderful guy. He's our chief of surgery. He's got an office right up the road. He puts a lot of time into our facility. He's a very good friend and a member of our board, and that's Dr. Surinder Grover.
Well, thank you, Russ. Good afternoon, everybody. I'm very happy to be here. It's my pleasure to address you this afternoon. It's a very exciting time for all of us. As an orthopedic surgeon on the staff at RBMC for the last 25 years, I'm extremely excited about this new addition as it marks the expansion of our surgical capabilities here in Old Bridge. This new building will be equipped with 5 new state-of-the-art operating rooms, making for a highly proficient environment for surgeons to take care of their patients. Today marks the beginning of a new chapter in the history of RBMC, one that's sure to contribute to continuous growth and success not only for Raritan Bay Medical Center, but Old Bridge Township. I want to thank the hospital board of directors, executive staff, and people of Old Bridge for helping make this day a reality. Thank you.
Thank you, Doctor. I'd also like to, as I said before when I introduced the relationship that our senator has with not only our hospital but the entire township and the area, I'd like to have Senator Sam Thompson say a few words.
Thank you. I'm delighted to join in observing this wonderful occasion today, and as Michael Dignan said, this has been a tremendous period of for Raritan Bay and for Old Bridge here recently with the recently announced merger, with the finally construction of this building. You know, I have been a guest in your facilities on several occasions. In fact, something in excess of 25 years ago, I happened to be visiting and had a cardiac arrest over there. And because of the fine service they provide, I'm still here talking to you today. I commend Michael Dagnus and members of the board and the medical staff, and et cetera, for the wonderful job they've done and the care that they provide to our citizens here in Old Bridge and the surrounding area. What they've done for years and what they'll be doing in the future. And this is so important to the health and well-being of our citizens. So again, I commend you and I congratulate you, and I think, boy, we're on to bigger and better things. Thank you.
That's what's great about Sam. He says the right things and he says them quickly. The next person I want to introduce is taking on the responsibilities of the leadership of our community. It's not an easy task, but it's one that's quite rewarding when it goes right. And I will say that he has been a tremendous help, along with his staff, to the completion of our building. He's been there anytime we needed for whatever the cause was, and he's putting in tremendous hours, not only in his capacity, but around our community. So it gives me great pleasure to present our Mayor Owen Henry.
Thank you, everyone. That's the problem with going last. Everything I wanted to say has already been said already. And that's why I didn't write anything down, because I knew that. But what I really need to say here today is congratulations. Congratulations. There was a lot of thank yous, but congratulations to the people who had the vision, people who thought that at one time there'd be a big building standing here, and how much work goes into that. I don't think people realize, once you have a vision, then you need to come up with a plan, then you need an application, then you need approvals, then you need permits, and how much work goes into that and how much of an effort that is. And because of all the hard work